Hello, my name is Kathy, and today I'll be discussing how to use homeopathic remedies on ailments, continuing with Fertility and Pregnancy I to V. But before I do this, I wanted to let you know that because I have a great many videos now on many different topics, that I've decided to make several different video playlists so that it's easier to find the videos of greatest interest. So please check out my playlist page. Please refer to my How to Use Homeopathic Remedies video before using the material in this video. I'll be discussing how to use homeopathic remedies on specific ailments, but I've broken these ailments into categories for easier reference. I'll begin with ailments of the mind and emotions. Then I'll move on to ailments of the brain and nervous system. Then I'll address issues with your skin, nails, and hair. Then conditions of the eyes, ears, and nose. Then ailments of the teeth and gums, then issues with lungs and respiration, then ailments of the heart, blood circulation, muscles, bones, joints, esophagus, stomach, duodenum, small and large intestine, liver, gallbladder, pancreas, kidney, bladder, then ailments specific to women and to men, and the issues of the hormones and metabolism, homeopathic remedies on infections, infestations, and the immune system, issues surrounding fertility, pregnancy, childbirth, postnatal problems, homeopathic remedies that address special problems in infants, ailments and diseases in childhood, and special issues of adolescence. And finally, special issues of the elderly. Of course, constitutional types have limits. In reality, each person is an individual, and so there are as many constitutional types as there are human beings. An account must be taken of the sum total of the person's inherent predispositions, past illnesses, diet, general reactions to the environment, intellectual and emotional features, and general attitudes towards life. This is what's meant by constitutional treatment. I'll be making detailed videos of the various constitutional types after I've completed the use of homeopathic remedies on ailments. The ideas, procedures, and suggestions in this video and all my homeopathic videos are not intended as a substitute for the medical advice of a trained health professional. Consult your physician before adopting the suggestions in this video. If you're pregnant, do not attempt these techniques without the approval of your physician. So, let us continue with learning how homeopathic treatments can help with fertility and pregnancy, I to V. Every month during a woman's reproductive years, a ripe egg is released from her ovary and enters the fallopian tube, and the mucus at the entrance of the womb at this time becomes less sticky. If intercourse takes place, millions of vigorously swimming sperm make their way through the mucus into the womb and into the fallopian tubes, where they congregate around the egg, causing it to spin around with the movement of their beating tails. Eventually, one sperm penetrates the egg, and the nuclei of sperm and egg fuse, and the process of cell division begins. The fused nuclei split into 2 cells, then 4, then 8, then 16, all containing the 46 chromosomes that will create a new and totally unique human being. 7 days after fertilization, this ball of cells embeds itself in the wall of the uterus. At 20 days, the placenta begins to form. At 30 days, the spinal cord. At 6 weeks, the heart. And by 13 weeks, all the body organs are formed. At 5 months, the baby can be felt to move. At 6 months, the lungs become functional and the nostrils open. At 7 months, the baby should be in the head-down position ready for birth. A full-term pregnancy usually lasts 38 weeks, counting from the moment of conception to the time the baby is born. Conception usually takes place halfway between periods if the woman's cycle is 28 days and regular. However, since many women's periods are not exactly 28 days, pregnancy is usually measured as being 40 weeks from the first day of the last period. Common pointers to pregnancy are missing a period, more than usual tender or swollen breasts and darker nipples, nausea, tiredness, a frequent urge to pass urine, and sometimes loss of appetite or cravings for unusual foods. To confirm the pregnancy, the woman should have a pregnancy test. The chances of having twins are about 1 in 80. Identical twins develop from the same egg and share the same placenta. Non-identical twins develop from different eggs and have a placenta each. Only 3 pairs of twins in every 10 are identical. Triplets are much rarer, only occurring in 1 in 6,400 pregnancies. Once it's determined that the woman is pregnant, it's important for her to go for regular prenatal checkups. Prenatal care is important since it allows you to find out at an early stage if there are any problems. An ultrasound, which is a sound picture of the baby in the womb, is thought to be harmless to mother and baby and can be used to monitor the size, shape, and position of the baby at any stage of pregnancy. Amniocentesis, which is the taking of a sample of the amniotic fluid around the baby, is usually carried out between 16 and 18 weeks, but only if a previous baby has been abnormal, or if there's a family history of congenital problems, or if the mother is over 35. Here in brief are some of the do's and don'ts of pregnancy. Treat your baby as a person from the word go. Moderate exercise, such as swimming and walking in the fresh air, are very good, but anything that involves repeated compression of the spine, such as horse riding or trampolining, should be avoided. Always keep 25% of your energy in reserve. Do go to prenatal classes. They will teach you what to expect and how to breathe in order to cope with pain during pregnancy. Don't wear tight clothes and get as much sleep as you can, and avoid late nights. Also, don't sit in hot baths for too long. 10 minutes is about the maximum, especially if you faint easily or have a tendency to bleed. Avoid serious traveling if you can, especially if you have had a threatened miscarriage, or there are complications, or you suffer from travel sickness. Most airlines do not like you to fly after 32 weeks or so if you must fly, check with the airline first and stop working before 28 weeks, if your work is strenuous. The expectant mother needs to eat a healthy, well-balanced diet with an increase in iron and calcium foods, and also a modest increase in protein intake, preferably in the form of oily fish, nuts, seeds, pulses, and whole grains, with generous helpings of raw vegetables and fruit. Will help to guard against constipation. Tea, coffee, and alcohol should be avoided, as well as chamomile tea, especially in the later stages of pregnancy. Homeopathic remedies during pregnancy. During the first 3 months of pregnancy, the most vulnerable time, you should avoid all medication if you possibly can. That means prescription drugs, recreational drugs, over-the-counter preparations from drugstores and health food shops. There is no evidence that homeopathic remedies cause any problems during pregnancy, but to be on the safe side, they should not be taken in potencies less than 6C, except for tissue salts. It is probably best to avoid low-potency apis altogether, and take 30C if you need to. For minor complaints during pregnancy, homeopathic remedies should be tried first. If you feel very unwell, see your doctor before taking anything. Indigestion during pregnancy. Indigestion during pregnancy is often a feature of late pregnancy, when the digestive tract and its veins and arteries become compressed by the expanding uterus. Breathing may also be affected. Specific remedies to be taken 15 minutes before meals for up to 3 days. Remedy of first resort, Nux, 6C. If Nux does not prevent indigestion, and the main problem is bloating and flatulence, use China, 6C. If fatty foods are the problem, with vomiting and lack of thirst and a stuffy room makes the indigestion worse, use Pulsatilla, 6C. Swollen ankles. Swollen ankles are most common in the 6th and 7th month of pregnancy and tend to occur in women who take too little exercise and whose lymphatic drainage is poor. Rest and walking usually improves the matter. More seriously puffy ankles can be a sign of high blood pressure or developing preeclamptic toxemia. Provided your doctor rules out the latter, constitutional homeopathic treatment would be beneficial. Swollen ankles or inflamed vulva is a similar cause to swollen ankles. Specific remedy for this, to be taken 4 times daily for up to 7 days. Bearing down sensation, as if contents of the womb are about to escape through the vagina. Sensation makes you cross your legs. Use Sepia, 6C. itchy, raw, scalding sensation after urination, soothed by washing. Use Mercurius 6C. Vulval swelling associated with constipation, ineffectual straining to pass stools, and always feeling there is more to come, urge to urinate. Use Nux 6C. Vulva and vagina excessively tender and itchy, but too sensitive to scratch. Use Coffea 6C. Swelling due to venereal disease. Use Thuja 6C. Varicose veins. Varicose veins are usually aggravated rather than caused by pregnancy, as the weight of the uterus begins to bear down on the veins of the pelvis. Usually one leg is more affected than the other. Exercise tends to make the stained veins more painful, and in severe cases they may burst. Get as much rest as possible with legs raised above the hip level and avoid constricting clothing. Specific remedies to be taken every 4 hours for up to 2 weeks. Remedy of first resort, Pulsatilla 6C. If Pulsatilla does not work and skin is marbled with knotted painful veins, use Carbo-Veg 6C. 1 foot hot, the other cold. Use Lycopodium 6C. I have a great many videos now on many different topics, so I've decided to make several different video playlists so that it's easier to find the videos of greatest interest. So please check out my playlist page. Well, that's it for now. To stay up to date with my latest videos, make sure to subscribe to this free YouTube channel by clicking the red subscribe button right below this video. Take care.